It's all the same usual segment times.
Good evening, everyone. I'm Anne-Marie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here with us again to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre-screening and simple non-invasive tests can actually prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk to the doctor directly. So stay tuned. We'll be right back. You're listening to News Talk 760 WJR. And we are on Facebook Live now.
Yep. So we're directly on Facebook Live. So what can we look forward to in this show today?
That's a good question. We have no idea what we're talking about today.
We had a plan.
You're not supposed to let the audience know that.
We had a plan, but then the plan sort of went askew, and we moved on to Plan B. So I don't know, maybe heart failure. What are we going to be talking about?
Well, I'm sure we'll talk about COVID a little bit, just to, hey, where are we with COVID? Because things have changed internationally.
What's changed internationally?
Well, England has lifted all COVID restrictions. There's no more COVID passports. It's over in England.
We're ready to go, Shivani. Hearing that?
Right. I mean, England has just lifted it all. So don't ask me everything they've done, but I just know it's over. And that's how it should be. And Israel is on their fourth booster with the highest rates of Omicron in the world.
That's good to say. That's really good. That's good information. Start off with England.
The whole country's been boosted and they're on their fourth shot. And they still have COVID all over the place there, which means it's worse to get a shot. This is not you got nothing to lose. It won't hurt you. It will hurt you.
What'll hurt you?
The vaccines.
And we know this for sure?
Observation. If all of Israel's getting COVID and they've had 4 shots.
Well, it's not helping. I mean, it's not helping. Welcome back, all of you listeners, to our live weekly medical show here on News Talk 760 WJR. I'm Anne-Marie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that number is 800-859-0957. Dr. Kolender, welcome back to another one of your very informative shows. Siobhan, hi, you're in Chattanooga today performing. And Dr. Kolender, before we get started on COVID, which is inevitable, I do want to say that one of our loyal listeners, a veterinarian, mentioned to me, I met him in a store last week, and he said, we're always talking about COVID. And he said, how about if Dr. Kolender talks about some of the other diseases, which I promise we will get to, and the care that you give in your concierge practice, because it's obviously not all about COVID. So it's my fault that I'm starting with COVID tonight, not yours.
This is a time to let this audience know about our Sunday show. We tell our Sunday audience about this show. So on Sunday, we spend a lot of time getting the details of prevention, heart attack and stroke prevention, because we don't have callers, so we have time to talk a lot about it. So
that's right.
That's a great time to listen in and learn a lot of details about that. But we do have to start with COVID because it's COVID.
Well, yeah, but just over the break there, before we, came back to the live show, you gave us some important information about England and Israel. Let the listeners know.
Right. So great news is in England, They basically lifted all of their COVID restrictions. So there's no mask mandates anywhere, and there isn't going to be any more vaccine passports and no more requirements at all. And that's great news. Um, the first country to really do something positive and following the science. The other news is Israel, who's done 4 shots for everybody. 2 shots in the beginning, a third, and then a 4th shot. And they have the highest case rates in the world right now for COVID. So
what you're saying is the 4th booster, I mean, not the 1st, the 2nd, 3rd, but we're now in the 4th in Israel, and their numbers are still flying out the door. What's the reason for that?
they don't work. And if we're seeing that highly vaccinated areas are getting more cases, it's more than just saying they don't work. It's harmful to have viral illness all the time. So if maybe these vaccines are predisposing you to getting COVID, that's what seems to be happening over there. And previously we say, well, follow Israel because they're doing data, but my God, I can't believe how wrong they were. It's really shocking, but still, kudos to England for, leading the world and saying, you know what, let's just deal with COVID as it comes. People will recover on their own.
So, Shivani, you listening to that? Rule
Yeah, but I'm wondering
Britannia.
what was it that changed in England? Because at the beginning they were one of the stricter countries, I believe. They had some of the biggest lockdowns, I think. So what was it that shifted?
I don't think I can tell you. I don't know. I just heard that news and I didn't realize that they
Sure.
were so far ahead, and I was happy to hear it. But I don't think it requires that should be happening here. To me, the evidence is obvious that the vaccines aren't working, masks don't work, early testing is appropriate. To me, we have all the evidence already to make that kind of move here, but it's not going to happen.
All right. Well, Shivani, you have a
Yeah.
caller?
Yeah, we had a call come through. We have Craig from Canton on the line. Craig, what's your question?
Hi, doctor. Thank you for taking my call. I've heard your recent protocols the last couple of shows, but I have not heard you mention anything more about monoclonal antibodies. So have you dropped them from your protocol, or is that still something that's a tool in your toolbox?
Well, thanks for calling. I pretty much dropped them. From what I'm learning is that the Regeneron, which was great against the original COVID and Delta, doesn't do that well against Omicron. And the GSK product, and forgive me, I can't pronounce the name of it, but the GSK product may work against Omicron, but frankly, for most people, Omicron is mild and just not worth the trouble of getting it. Now, I know there's still people in the hospitals and there's still people dying from COVID, but again, that's not about getting or not getting monoclonal antibodies. That's really about our healthcare system not letting people have access to early treatment. Early treatment on day one is very impactful and does the trick most of the time.
Yeah, I think the most important thing, as you've said all along, is getting diagnosed immediately with it and then being in the care of a doctor like yourself that's going to give you treatment for it and not go to the hospital.
I think that's what you said is very important. Being able to talk to somebody about, hey, this is what's happening to me today. What do I do? Because if you have no one to talk to and you watch the news, you think you're going to die and you go run to the emergency room and you get admitted. And guess what? Your chance of dying just went up about 75%.
Right.
So staying home, gutting it out under medical care is great, and no reason for there to be deaths from COVID. This can all be handled as an outpatient with doctors who have the time to take care of you.
Yeah, and the most important thing is getting into treatment immediately, which is what you're doing. None of your patients died. None of your patients went into the hospital with COVID, and you've just managed to treat them through the process. So I think that's what everybody needs to face up to. Quit thinking that you need to run to the ER because it doesn't help.
Yeah, and we'll come back after the break.
Let's talk more about this on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. That's 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live,
We're
on
back
the air
on
again at
Facebook. Well,
7:19.
Somebody's on Facebook. Oh,
What?
there we go. When we come back, I had a patient call. If we can, we don't get any callers. Because he's a regular listener who texted me today. They had COVID, and it was mild, and I told him, I don't care. Take the ivermectin right now because we can't afford to let its ugly head come up. So even if you think it's okay, you got it under control, you gotta, put your foot on its neck and prescribe the drugs and just not let it ride it out. There's no reason to be a hero.
And
Take
then,
everything.
yeah, but once again, as you're talking about that, I'm thinking about the last week's challenges. Which pharmacy are you going to go to?
Well, but he's
You
calling me, so I've got my pharmacy to call.
do, that's right. But the
Right.
average listener isn't calling you and you
Well,
having
it's not about the pharmacy. If having a doctor who's going to take your call and even agree to fill the scripts, look how few doctors are filling the scripts, and you can't get a pharmacist. Imagine if twice as many, which is 5. There might be 3 doctors prescribing, hydroxychloroquine, ivermectin, which we're saying on Facebook out loud, even to our, how many Facebook followers right now? Our 4 Facebook followers, which is why we're not being tagged.
People watch it later though, just because they're not
Yeah.
on live.
Yeah,
just
that's
'cause
true.
They don't see it, so.
The great voice.
the
So,
great voice. Yeah.
We did have a caller come through though.
oh, good.
for
Well, maybe
vaccine.
all right, let me tell that story really quick, and we'll go to the
Yeah, yeah.
caller after, just to say, look, you gotta, just doesn't matter if you think you're okay. You gotta take everything right away. Don't
Yes.
wait for it to get bad.
Start treatment. But again, it's a sad story of humanity that they don't have the doctor that they can call or get through to or get an appointment to see. It's really getting wicked. It's just really getting wicked here with no access to
Well,
medical
maybe
care.
England will lead the way, and people will wake up and go, look what
Well,
happened.
you were always able to go in England and the UK. You were always able to just walk over to the local clinic. That's the way it works. The doctors are always sitting there. It's always open. There's no such thing as calling and saying hi and waiting for a receptionist to answer the phone. You just simply walk into the local clinic. And that's the triage. The local
Well,
clinic is the triage.
They also went through some stretches where it was questionable. They had they were about to go to the dark side, like our country did and is, and I think they pulled back.
Mm-hmm.
So they were not releasing conversations from their drug usage meetings. Their version of their FDA was being sequestered, so they were starting to withhold information and not be open. And thankfully, went back.
No, they've succumbed. If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Siobhan in Chattanooga, you have a caller?
Well, before we
Yes,
go, I
we-
just
no,
want
go
to jump
ahead.
in. Sorry,
Sure,
just
sure.
so
No, go ahead. Go ahead.
because last segment we're talking about early treatment. So one of my patients who's a regular listener, Mike M, texted me to let me know he had COVID. It was a mild case. What do? I said, you got to take the ivermectin right now. Don't wait for it to get bad to start going on a full therapy. So that's the key, is early treatment right away. Don't wait to go bad. Don't take a chance, because if this thing goes bad, it goes bad quickly. You got to be aggressive early.
But again, once again, you have to have a doctor that you can talk
Right.
to who can, people can't write their own prescription.
No.
So the first door is open the door to an MD, a doctor that's going to be able to treat you and shepherd you through the process. Siobhan? You have a
Yeah, so
caller?
we have Heather on the line in Riverview. Heather, what's your question?
Hi. Well, I guess I know that the topic's kind of focused on the virus right now, and I can tell you firsthand that I can't advocate enough for what you're talking about, the virus, because I was proactive, went to America's Frontline Doctors, got the ivermectin, got the Z-Pak, and um, it worked like a charm. So for those of you who are out there, and maybe even if you find a doctor that will fill the prescription or that will write the prescription for you, Walgreens, CVS, and Rite Aid won't fill them. So you have to go to an independent pharmacy to get the prescriptions filled. I've found that out firsthand.
Boycott.
The reason,
Colander
yeah,
mandate 2. Boycott.
I'm all over it. Yeah, but the thing that I was interested, you are advocating and letting everybody know that you're more on the preventative side, and it couldn't be more obvious to me that I have to make a change in my primary care physician, because I've done quite a bit of homework on the virus, and my primary care physician at one of the major medical facilities in the area, and they were stone faced. They didn't want to do anything for me and he said, "Oh, how did you get yourself on, ivermectin or hydroxychloroquine?" And anyway, long story short, I think for the audience's benefit, you're talking about cardiac care and preventative care. One of the things that I think the audience could learn from you, beyond the virus information that you have to share, which is very valuable, is in addition to cardiac care, what types of work do you do in your office in terms of preventative care for endocrine-related issues or dermal, skin-related issues, or other areas in the body where for example, if somebody has cholesterol, cholesterol is not good for your arteries, and that becomes a cardiac issue.
Well,
So
Heather,
I
got to jump in and let the doctor answer. Otherwise, you're going to have 15 questions in here. We've got other callers. So, Dr. Kolender, she's basically asking the question of, what do we do about all the other issues that patients have? And you're handling all of those other issues.
Right. We appreciate you calling, Heather. And so you're absolutely right. We do need to work on heart attack and stroke prevention, which is actually our wheelhouse. That's what we do. And so we start by identifying people's disease, and their disease is plaque. And the test that we use is a CIMT, which is a carotid intima media thickness test. It's an ultrasound. It measures the layers of your artery wall. And one of the layers is a representation of your body's inflammation. So in my patients, I know where they are health-wise, which is probably why a lot of my patients have done really well with COVID, is because they're already on a program to reduce their artery inflammation. And so part of our process is addressing endocrine issues, addressing sleep issues, genetics, vitamin deficiencies, oral health, all of this together. And it ends up helping a lot of skin issues. So when you're addressing your total body's health, things you wouldn't expect to get better, and we're reducing your risk for cardiovascular event. And in my belief is you can reduce your risk of cardiovascular event to 0, but you've got to follow the right data, do the right things, and you need somebody who's able to do that. And obviously that doesn't happen in our traditional healthcare system.
Okay, Siobhan, you have a caller?
Yeah, so now we have Dave in Rochester on the line. Dave, what's your question?
Dave.
Hi, doctor. You mentioned your treatment of your COVID patients, and have you ever released any studies or data, numeric data on how many patients you're talking about?
Well, thanks for asking. That is a good question, but no, I'm not doing research studies on my patients. I can just tell you, because I know them all, I probably treated about 120 patients with COVID. I've only had one person in the hospital, and that was last week, and they've been discharged. They're doing great. So 0 people in the hospital from COVID. hopefully moving forward, we'll be doing a little bit more cardiovascular prevention research with some of the initiatives that I have planned in the next months to years.
Well, I think, patients just need to know that your practice is very broad and that you're not just treating heart attack and stroke, you're treating the entire gamut of, like the caller before, endocrine disease, whatever the diseases are, diabetes, whatever. It's getting someone like yourself who can shepherd them through the process and be available all the time.
Well, thanks, Anne-Marie. It's about having the data to follow. So a lot of the traditional data markers that you all know of, like cholesterol, I don't care about. I don't care about your weight. And I don't really care about hemoglobin A1Cs anymore. I don't think those are data points that identify risk. So I'm able to see people's A1Cs reduce and they don't lose an ounce and their A1Cs don't move. And, I don't know if that, we're going to learn over time what that means, but the process is identifying new markers to follow. And that's the thing, is you got to put the data together and shepherd people through and educate them.
Yeah, well, the most important thing again is having access to the type of practice that you have. And it's not that you're radical, it's just that you're looking at things that are giving you positive outcomes with your patients and not necessarily sticking with the protocol that's been handed down as to, the standardized tests that everybody's doing.
Well, the standard of care is a joke. I mean, it's a total joke. So forget that. Population medicine, what other doctors are doing, it's awful. It's all there just to, get pharmaceuticals and surgical procedures. So not to say I don't use pharmaceuticals, but when they're used the right way, they're very useful. But when they're not used the right way, which is unfortunately they're not, then people get skeptical. They don't know why they're on a drug. It doesn't make any sense. They're worried about side effects. But when it's done for the right reason, then compliance is better, and plus people do what they need to do because their lifestyle does play a big role in prevention.
I know, and you don't necessarily follow the regular protocol of what the tests are that the other primary care physicians are using.
Well, for
You've got your
cardiac
own.
tests, like I don't ever do a stress test. And frankly, I don't
Exactly.
really refer to cardiologists for vascular issues. I need them for irregular heartbeats, but not for the plumbing. Yes, electrical, no to plumbing. Yeah, we don't do any of those traditional things. The things we do in our office are non-invasive and simple.
And more advanced. In the meantime, we're going to have to take a quick break. Again, you are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR. Am I doing segment 4 next?
Yes, you
Yep.
are.
Okay, I'd just like to know, since Siobhan's being very quiet over there and not
Well,
talking about anything.
No, well, I'll actually chime in because we do have a question through the Facebook feed from Danielle, and she says, "What are some steps we can take to help prevent or prepare our bodies for COVID? I have my kids all on elderberry with vitamin C and zinc. What other suggestions do you typically recommend for normal, healthy patients?"
well, as you know, listen, there are 5 people on Facebook. The main thing to know is vitamin D is the most important thing. That's really the number one vitamin that helps boost our immune system. And then generally being healthy. It's not just all about supplements. It's knowing what kind of diet your body needs and following that diet, exercising regularly, making sure you're getting sleep because sleep restores you, depending on how old you are and your needs. Make sure your hormones are balanced. All those things are really important. It's not just, hey, take some supplements and I'm fine. You've got
But how
to
do you find out all of those metrics, though? That's the thing.
Right.
Well, again, you've got to have someone who's going to look at those, and it starts with, where's your disease? Do you have plaque? Because that's our objective measure. And then we work backward from there. So we start at the top, work down. So unfortunately, a lot of doctors, especially holistic doctors, they're looking at it from I do a hormone thing and I do a gut thing. those are just pieces of, a 20, 30 piece puzzle. We want to start and have the whole puzzle and make sure that all the pieces fit.
Right, but the unfortunate thing again is access. The unfortunate thing again is that not everybody's going to your practice. I mean, if everybody in America went to your practice, we'd all be okay, but it's not, you just can't handle everyone. But I mean, what do we do about all the rest of the doctors that we need to convince to transfer over to following your protocol?
Well, we're learning today that it's frighteningly difficult to get doctors to take the leap to doing practice the right way. It's shockingly difficult. When you practice in a non-traditional way and doctors are afraid of you, they don't want to do it. And this is bad for people. This is bad for all of you out there because you just can't find doctors willing to practice good medicine. They want to stay in the lane that they know, and that's it.
Looks like you've got some other callers coming
Yeah,
in,
we
Siobhan.
did. We have 2 calls that came in.
Well, that's good to know, but I mean, it's like it's a challenge, and I mean, we're only reaching so many people through the radio show, but what about the rest of the people in the country that are just lost?
Well, we'll hopefully get to them next few years.
Hopefully,
You're
yeah.
right. We've got a lot of work to do, but hopefully in a couple of years we'll have some way to address everybody.
So, in the meantime, we got another minute to talk on Facebook. So, what else do you have to tell the Facebook listeners?
I don't know. Olivia, anything you want to add? No.
Olivia, no, Olivia's yeah. What?
Oh,
Got
only
the-
30 seconds. All right, good.
Yeah.
So, no, I think, what are we going to talk about next segment?
Well, we have 2 calls,
Oh,
so maybe we can
calls.
let those
Oh,
spark.
that's
yeah,
right.
the
We take
conversation.
calls. I forgot we take calls on this show.
Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about 2 important topics, prevention and being proactive. Please tune in to our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Siobhan, you have some callers waiting in line.
Yeah. So up first, we have Cliff and Leonard on the line. Cliff, what's your question?
Hey, Dr. Kolender. My question is, I had a heart attack in 2012. I got 2 stents in the LAD. I had 99 and 77% blockage. I went to the hospital. They put those in there. Currently, I'm on metoprolol, lisinopril, and I knew this would happen.
You're probably on a statin.
I'm taking an astatin, Lipitor. And am I going to be on these for the rest of my life? Is it something that I can eliminate?
So to answer your question, thanks for calling. You're going to be on them the rest of your life because statins reduce inflammation when people have plaque and you have plaque. The ACE inhibitor drug you're on, lisinopril, is great at preventing heart attacks. There's a better one that I use. I use ramipril to prevent strokes. And then because you have disease, you need to be on an aspirin. So, I mean, this is a whole other show. We've done shows on aspirin, so we won't get into that today. But you have plaque, so you need an aspirin pretty much for life. And then you need to get into an evaluation to figure out, why did you have a heart attack? Why did you have plaque? Why do you have a stent? There's other conditions that you have that are not being identified, and I can tell you that without knowing anything more about you, that you need to figure out to deal with. Otherwise, you're going to have more disease. People who have cardiac disease are at higher risk for other events. So taking those drugs is not enough. It's enough, that's standard of care. And it does not mean you're in the clear. You need to identify your inflammations panel. your IMT levels, and all the other drivers of disease so you can address them.
How old is the caller? How old are you, Cliff?
I'm not sure.
62 now.
How much did he say? How old?
Young, 62.
62.
Yeah,
Yeah.
so and he's already had 2 stents. That's kind of pathetic.
That was 10 years ago. So, yeah, so you need to make sure that you understand all of the other conditions that cause you to have disease. I guarantee you it's not just, oh, your cholesterol is good, your blood pressure's covered, you're fine. That's not the whole story. There's a lot more to dig up.
Yeah, so Cliff, you better get into some better care and better advice, that's for sure. But thanks for calling. Siobhan, you have another caller?
Yeah, up next we have Dave in Windsor, Canadian friend. Dave, what's your question?
Yes. First of all, doctor, I want to congratulate you for being, doing the best possible health care that you possibly can in your area. And the next thing that I want to suggest is this. What about, getting therapeutics and nutrition over vaccines in coronavirus? Many times people get tense when they hear Omicron, and all it is just a mild case of leaky nose and whatever the case may be, without letting the nose drain all that excess mucus that it doesn't need. What can you suggest about that?
Well, thanks for calling, Dave. So, because Omicron does sit in the nasal cavity more than the other variants, using like a nasal spray with either saline, that helps create an acidic environment in the nose to kill the virus. You could do a rinse with diluted hydrogen peroxide or diluted providone iodine, and that'll help kill the virus. There are some products out there that have all that together, but that's a way to get rid of it. So it's not a question of like necessarily just letting your nose run to let the virus out. You want to spray in one of those things to actually kill the virus, and it may help reduce the spread to other people and actually just reduce reinfection within yourself. Plus all the supplements, plus your ivermectin, and if you're having a really bad case, I would throw on there hydroxychloroquine also.
And a question here, since the Omicron virus is so effusive and not what do I want to say? You don't get very sick with it. That's what I'm saying. You don't get very sick with it. And so therefore there must be a lot of people who have it and don't know they have it. And should they be doing this? Should they be taking nasal sprays? And, for example, if you wake up one day, you feel under the weather and you've got the sniffles, how do you know that you don't just have, a normal reaction to a cold, a flu, the normal viruses that we're used to? And should we be, using nasal sprays to, as you said, the saline spray will kill the virus anyway?
Well, you're bringing Kolender mandate 3 into effect, which is no testing. So don't bother with testing. Just in case everyone wants to know, Kolender mandate 1 is no more vaccines. Number 2 is boycott all these pharmacies. And number 3 is don't bother with testing anymore. So if you are sick right now, just assume it's COVID and do all the COVID things that we're talking about. And don't wait to see if you get sick or not. Just start right away. None of these things are going to hurt you. And even if it's not COVID, there's a good chance that they'll help knock out the virus that you do have. So speaking about what you're saying, Anne-Marie, if you have a scheduled, random, routine nose swab for something stupid like a job or travel, I would start doing that spray, a few days ahead of time and spray like crazy just to kill out any random.
That's a good idea.
COVID
That's my point. Yeah.
Right. I mean, who knows if you're still shedding virus from being asymptomatic exposure. Do that spray, kill the virus. Now, is it going to work? I don't know, but it sure won't hurt, so that you pass your COVID test and move on with your life.
Yeah, because people don't know. There's probably a lot of people out there that have already had it or they've got it and they had a mild case of what seemed like a normal flu or a normal cold, and they never got to the point of getting to a doctor to find out or even to get a test, because for a while there we didn't have access to the testing.
Right. And I don't want to suggest that what I'm telling people right now is to hide their symptoms, go do the spraying, get your testing to get whatever you needed the testing for. If you are asymptomatic and you need to get a test to get something, well, then do the spray. If you're symptomatic, well, then get treated, which also includes the spray.
Right, exactly.
Right. So I'm not telling people go out and hide your COVID and do the spray and, do whatever you want to do. Stay home, recover, take all the supplements, take the drugs, and get over it. And then do the spray so you can go do whatever you want to do. Go see a
Let me-
Starshed show.
Go ahead, Siobhan.
No, I wanted to ask you a question. If you should test positive, but you are asymptomatic, would you also recommend getting treated? Or if you're asymptomatic, would you just ride it out?
There's no reason to get tested if you're asymptomatic. So you're only getting tested if you're asymptomatic if
If it's
so-
required, what
a
about
re-
if it's required?
That's
Sure,
what I
sure. If
mean.
you just happen to discover that,
that's what
you
I
have
mean.
to take a routine test.
Well, you got to prep for it. Do all these sprays ahead of time to give yourself the best chance to have a positive test. And then if you do have a positive test, you have no symptoms, you got to quarantine with a mask and then wait for symptoms to happen. Then I would treat it. But I would not treat someone who's asymptomatic.
Okay.
I'd look at it as a false positive.
Mhm.
Again, that's why there's no testing. False positives, false negatives. I don't worry about a false positive, then I'm over treating you, no harm. But a false negative is horrible because someone's sick and I'm not treating them because they're negative. And then I've had several of that in the beginning of Omicron. People sick, they get tested, it's negative. They do a rapid, they do a PCR, it's negative. And then a week later, they're calling me like, I'm still sick. Go get tested again. Oh, it's positive. We missed 8 days of treatment. And if this person were sicker, they could have had a really bad outcome. So don't bother with any testing at all. Just if you're sick, assume it's COVID and treat it likewise.
And they have to be able to get to the right doctor who's going to see them and who's going to get them on the right treatments. In the meantime, we have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and you would like to hear from the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. So we are coming back for segment 5.
Yep, last segment. We're back on Facebook Live.
Well, let's talk prevention if we can.
Right, I
If there's a
totally agree.
chance.
Sure.
Enough COVID. Let's kind of round out a little preventive issues. And then if someone calls, they call. But callers are saying stop talking about COVID, basically. That's what that call was. Enough COVID. Right. That's what that person said. Listen to the callers. Enough COVID.
Sounds good.
Get back to the bread and butter.
Right, exactly. Of just preventing
Who was that
disease.
person who said that? Who was like the third caller? The guy said, stop talking about COVID. Or did you say it, Anne-Marie? You said
No, I
someone
never
told
say
you.
stop. Oh no, that was the beginning of the show when I said I was actually in a salon when this guy was just recognized my voice and said, "Wait a minute, I know who you are. You interview Kolender, and he's always talking about COVID." I said, "He's not the one that's talking about COVID. It's led by the callers
Right.
Mhm.
on the live show. What are you getting? And you know what? It's not really about COVID. You know what it really is about? It's about
Access.
abandonment.
Right.
It is about total abject abandonment, worse than it has ever been before. Because you know what we did? We gave doctors a pass to say, guess what? You're not getting in the building. You're not getting up on my floor. You're not getting through the door. I'm not even going to call you. Maybe you're going to get telemedicine, but you'll wait 3 weeks. And so what they're doing is shutting out the patient altogether. And I think that is reprehensible. Because before, if you got sick with anything, I don't care. If you burned yourself, you fell, you got a nosebleed, whatever, you could always go to your doctor and be seen by your doctor, and your doctor would treat you. Now, all these doctors, they're locked in jail. You can't see them anymore.
Can you repeat that on the show, but just a little more anger and a little more conviction?
No, but I'm fed up with it. I'm just like, it's
We
like
get to
that.
the end of show rant that happens when it's
Right.
it's
Not
the
on
break.
and not on the show.
And I'm happy to talk about it on the show, but I'm sick of these doctors that have locked themselves in. You know what? That's who should be fined. That is exactly these doctors that are not willing to see patients. They should be kicked out.
Well, remember we talked about the other show, which is they're following the guidelines of their employer who is setting the rules. and they've given up their right to make
Do you
decisions.
really think Beaumont Hospital cares about whether somebody's seeing a patient or not seeing a
Oh,
patient?
absolutely.
Why would they care?
Because they don't want.
It's more billable time. They're getting paid for the visit. They're getting paid for everything. The
They
pharma
don't.
companies are making money on the
They're still billing as a telehealth. They just don't want their hospital or their area to be like a source of a COVID outbreak. Unless you're sick in the hospital, they don't want you there.
Everyone's
working from home.
No, right?
Not our engineer. He's been here all along.
No, but I mean, it just is ridiculous. No, I'm anti-doctors right now.
Good.
No, I'm serious.
I'm serious too.
I think-
Hold it in a second. Hold on to that and let it out again.
Well, I can't really say anything because you're a doctor. I mean, it's kind of.
Don't worry, I'm excluded.
Yeah, okay.
Everyone knows you're not talking about me.
Right. Okay. Well, I'm
Go
glad
ahead
to know that.
and name some names while you're at it.
Yeah, right. I'm already in trouble with them. Okay.
Name some names.
They already kicked me out. So
Say Dr. T from Troy.
welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. So, Dr. Kolender, coming back to the subject at large, which was about COVID, and we're getting callers, but as I said to you over the break, I'm fed up with these doctors that aren't willing to see patients. That's what they're getting paid to do. They should be forced to see patients. It is just nauseating to think about the fact that you can't get an appointment, you can't get through, you can't get into the building. You might not even be able to get up to the third floor. How about that?
Well, the only time off I took from work was when I actually had COVID in March of 2020. So I haven't been working the whole time. I'm working right now. So we haven't taken a day off.
And your patients are physically coming in to see you. You're not only treating them for COVID, you're also treating them for all of the other diseases that they have that are chronic diseases because those can't be ignored. And I mean, what about if you're diabetic? What about if you have some other systemic disease that's not COVID related? You have to pass a test to get in to see your doctor. They should all be fired. Goodbye. Telemedicine. No,
Well-
I'm serious. What are you laughing about,
We're-
Siobhan?
No, I'm glad that you saved your rant for the show because you're right. You're right. It's very
No, but it's-
frustrating. I mean, on top of dealing with the medical crisis, you then also can't get advice from the one person that needs to give it to you because you have to wait.
And you're paying, how about the huge amount of medical insurance that people are paying, whether their job's paying for it or whether you're paying for it independently? You can't get to see a doctor. You can't get into the building. And it's getting worse all the time. And so you're the only lone person out there that's staying open and seeing patients. And guess what? You're none the worse. Your patients are certainly better. You're helping them with their ordinary diseases as well as just COVID. And if they get sick from COVID, you're treating them right away. Okay, you know what? Let's fire the rest of the doctors. How about that?
Let's go. Line them up.
Unfortunately,
Pink
I'm
slips.
not in charge. Okay.
Get the
No, but
pink
I mean,
slips. Start handing them
is
out.
there nobody in charge in this country that's making these doctors see patients? That's what you're supposed to do. You went to medical school to heal people and you should stay open. Doesn't matter whether it's the plague or whether it's COVID.
Well, who's the Secretary of Health and Human Services?
And is that person going to change
That's,
anything?
Well, you ask who's in charge.
I understand. but I-
Or Dr. Fauci, who's the highest paid, government official, more than
Well,
the president.
I mean, it's.
He's a doctor, and he seems to be in charge. Maybe he'll can tell
I
you why
you
doctors aren't treating
you always
COVID.
go back to Fauci.
It's been a
You-
long time, but
you
it
know,
feels
you
good.
try to go back to Fauci all the time, and I'm glad you're happy and letting off some steam. But as a consumer out there, friends and family, neighbors, getting in to see a doctor is getting worse, more draconian than it ever was before. And this is like as wrong as it should be because that's what the doctor is there for. The Hippocratic Oath. You are there to cure, to see, to heal, and to take care of me, and you're getting paid to do it.
I mean, what none of you realize is that how much damage your body is going through right now, not having access to care and advice and treatment. And I'm seeing it in my practice. So even in my practice where I'm following these things, I'm seeing my patients that I haven't seen for a while. Some I haven't seen in a year and a half. They're coming in now, and they're
Yeah, I'm going to
marked.
stop you right there.
Yeah.
This is a year, like you're right, a
And
year and
these
a
are
half.
people who pay
How
me
about
to
2
come
years?
in. Right. Well, I'm getting their markers. I'm getting their IMT levels. I get their inflammation levels. I'm measuring their insulin resistance. And these numbers are all off the charts high. I mean, they're going to get better, but unchecked. And these are people who have guidance, of what to do. So unchecked, that's what happens. You just go off the rails. So we're going to be seeing the damage of COVID and the lockdown and lack of access to care for years. And again, it's going to all be attributed to COVID, but really it's attributed to lack of prevention and lack of attention.
Yeah, and as you said in one of the prior segments, good for England that they lifted all the restrictions and they're open and they're done with all this nonsense of, finding a good excuse to shut everything down. Shutting down access to healthcare is absolutely ridiculous. You yourself have said, don't go to the hospital. It's not going to help if you have COVID. But what about the people with ongoing disease processes that need to see you for whatever, for their diabetes, for their emphysema, for whatever that has nothing to do with COVID, and you're just shut down? And well, not you, but other doctors are just shut down and you can't get in.
Well, each of you are going to be paying that price for a long time if you survive it. That's the bottom line and it's going to get blamed on COVID, but it's really about just lack of attention, lack of prevention, lack of access. And again, they're going to all label it post-COVID. There really aren't any markers yet to identify what that is. It's too non-specific. They don't know what it is. We're up for a scary time still. Even if COVID goes away, even if it's done with Omicron, we're going to be dealing with the aftermath for a long time. Plus, oh my God, the mental health.
That's a whole nother story, the mental health. That's a whole
what
nother
this
story.
thing did to everybody. Everyone's a mess.
The isolation, the alienation, it's
the
unbelievable
anxiety,
damage.
the PTSD.
Right.
It's unbelievable. And I mean, we've all been traumatized. And
Yeah, no one's caring about that. We don't even have enough psychiatrists to go around.
No. And actually, I've thought about getting back into therapy. I've called a few people I can't get in.
It's ridiculous.
Right. I mean, I'd only call one person, but they can call me back. But it's very, that's the real trauma, because you just can't. The other stuff you can fix. Again, in the right hands, it can be fixed. The insulin resistance can be reversed. Arteries heal. Chronic disease can be dialed back. But again, you got to work at it. The mental health thing is very hard. Very hard. You do need extra help with that.
And of course, there's no access. I have a quick question for you. You're in a private concierge practice. You've been open all the time. None of your patients have gone to the hospital. No one's died from COVID. How many other concierge practices, you may not know the answer to this, but how many of the other personalized concierge practices, are they all mandated to see their patients and not shut down? And
I wouldn't use the word mandate. Every doctor does what they want to do. So they all make their own choices. I'm pretty sure there aren't that many other practices that were treating COVID. And they made their own choices, whether they want to be in office or not, whether they want to stay virtual or not. But it's, the inability to lay hands on people, to do an exam. It's just like having a meeting. You want to see people face to face. You want to see how they're responding to your questions, and so that you can, negotiate things. It's always helpful to have somebody in front of me so I can see them.
how do you put a stethoscope on somebody over the internet? How do you do that?
No, you can't.
Right. So telemedicine is totally useless. And trying to sell it is kind of somewhat barbaric.
It's right. It's being spun as helpful in increasing access, but really, we've talked about this before, it's a decrease in access, because now the doctor's really limited on how many spaces they can fill. And if you don't have an appointment on the computer, you're not getting in. It pushes you out even further. Whereas if
What
you
about
come-
the older population that doesn't have a computer, poor people that don't have a computer,
right,
people that don't know how to
underserved
use
people, right? They don't have
underserved people, right?
no internet access. That's not access. That's opposite of access. That's just serving the people that already have it and giving them, letting them stay home.
So what's the answer? We have 10 seconds.
Thank you. We need to really, well, for the listeners, they've got to find a doctor who's going to take care of them.
Exactly. Well, unfortunately, we're out of time, so I'd like to quickly thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, Anne-Marie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin. Please continue to tune in to our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.